So, you have decided that you want to enrol in the qualification, which is great, but it is worth pausing for a moment to consider these steps. Ensure you have obtained graduate basis for chartered membership with the BPS. This is through the completion of a society-accredited undergraduate degree in psychology. You will need to have successfully completed an accredited master's degree in health psychology, and by doing such a master's degree, you will have fulfilled the Stage 1 requirement. The final initial step is securing a Stage 2 approved supervisor. The qualification administrator can help you to find an approved coordinating supervisor in your area if you are not sure who might be able to supervise you. Your supervisor must be listed on RAPS. The register lists members of the health psychology profession who have undertaken our approved supervision training and are able to supervise you through your Stage 2 qualification. Once you have found a coordinating supervisor and formalised an agreement with them to supervise you, please complete and submit a request for approval of supervisor form, available from our website. Also, enclose a copy of your supervisor's CV. As Chief Supervisor, I will then look at this application, and assuming that your coordinating supervisor can be approved, you will have 6 months to submit your plan of training and the other enrolment documents, with the help and support of your newly approved coordinating supervisor. The enrolment form requires you to fill in details about where you will undertake your supervised practice, which is referred to as the placement host. We also need you to complete details of who in your placement host is responsible for welfare and well-being on placement, as well as a health and safety contact. The next section consists of a checklist of key agreement points between yourself and your supervisor, ensuring that they will fulfill the key roles of a coordinating supervisor. Also a checklist ensuring you and your coordinating supervisor have considered how the placement host will provide you with a safe and appropriate work environment in order to demonstrate the competencies. Finally, you and your supervisor will then complete a checklist of intended competencies to be met at the placement. This ensures you are in a position that will enable you to fulfill the requirements of the Stage 2 qualification. You and your supervisor also have an opportunity here to specify learning objectives for your placement, as well as any details of additional workplace supervision that may be appropriate for your training. You will need to provide the details of 2 referees here. One must relate to your academic studies and the other to your practice in health psychology. The workplace audit section is completed as a first annual review of your workplace. Specifically, you will ensure that the workplace is appropriate. For example, health and safety requirements are met and has an equality and diversity policy. You will ensure the objectives for the placement are appropriate and in place, ensuring the placement offers you the opportunity to add and modify learning objectives, and there is a clear assessment and support in place for you in the placement setting. You and your supervisor or supervisors then sign the form, and you will also have an opportunity to feed back to the BPS on the enrolment process. The plan of training is a document that you should complete in collaboration with your coordinating supervisor once you are both satisfied your workplace is suitable for the Stage 2 qualification. You will use the document to plan your work in relation to each competency. So for example, what are you going to do in your workplace to fulfill the teaching and training competency? So this might be a plan to deliver some training on behaviour change to nurses and also deliver a series of online lectures to MSc students at a university. It is important to note here that, as a whole, the qualification must be addressed in at least 2 distinct areas of work. The difference could be in terms of the nature of work undertaken and the population. The purpose of the plan of training is to demonstrate that you have adequate plans in place to fulfill the range of competencies. You are not required to explicitly identify at the outset how you will fulfill each and every competence. However, your plan of training will not normally be fully approved if your plans for 2 or more competencies are undecided. If your plan of training has any gaps, you will receive conditional approval and be required to submit a revised plan of training addressing these gaps in the time frame specified in your confirmation letter. The plan of training and the enrolment form are the key documents for enrolment onto the qualification. However, there are some additional documents to complete. You will have to submit a copy of the contract signed by both yourself and your supervisor, agreeing with the terms of your supervision, your first quarterly meeting record form and a copy of your job description. Please also enclose a health declaration, equal opportunities form and a copy of an enhanced DBS or the equivalent for Scotland and Northern Ireland. Finally, we would require evidence of completion of your MSc. Once you have completed these documents, send them into the Qualifications office for approval.